Now I am going to demonstrate thrombus in the left atrium on contrast enhanced CT scan. But left atrial thrombus or any intracardiac thrombus for that matter on CT scan is usually an incidental finding because we seldom do a contrast enhanced CT just for demonstration of a thrombus, because most of the thrombi are usually picked up by echocardiography, routine transthoracic echocardiography, and sometimes by transesophageal echocardiography. Because if you want to detect a small left atrial thrombus, the sensitivity will be much more for a transesophageal echocardiography than transthoracic echocardiography. That is because left atrium is a posterior structure quite close to the esophagus. So that's why transesophageal echo is preferred for detection of left atrial thrombi, especially in atrial fibrillation and in patients with mitral stenosis being planned for balloon mitral valvotomy. TE is the choice and not CT. This is a contrast enhanced CT scan of the thorax. Rib cage can be seen, vertebra can be seen. Lung is not well seen, only the lung vessels are seen. That is contrast filled vessels. That's because it is not a window taken for the lungs. It is meant for the contrast enhanced cardiac structures and blood vessels. This is the right ventricle, left ventricle, interventricular septum, free wall of the left ventricle, right atrium, left atrium. So you can see a well-defined negative shadow within the contrast-filled left atrium. That's a thrombus. These slight negative contrast could be due to papillary muscles or valvular structures. In the right atrium, this is not actually thrombus, because when you inject the contrast intravenously, it first comes to the right atrium, then to the right ventricle, and goes into the pulmonary artery and pulmonary vessels and returns to the left side of the heart. So the timing of the slice should be known. This is a delayed phase. So right atrium is almost emptied of contrast. That's why the negative shadows are seen in right atrium, not because it is full of thrombus. That you'll understand when you scroll through the CT pictures. You know that this is a delayed picture and not an early picture. But here, when it is on the left side, the left atrium is fully filling and only a circumscribed negative shadow is seen, typical of a left atrial thrombus. Similar negative shadows could occur due to masses also.